Our briefing today, and just like lots of days, we've got a lot of stuff to talk about. The biggest news I think of the day is just this, and our health officials will touch on this in just a little bit. It is we've got an outbreak over in the Eastern Panhandle. We'll get into that in just a few minutes, but the reality is just real simple, and that is we've anticipated this. Anything that is really close to a major city like the Eastern Panhandle is just right in the back door of Washington, D.C., where we've been on it. We've been concerned about it. We're not going to be a state that is just left out in this terrible virus and this terrible epidemic or pandemic. So we are going to have issues. We're going to have to deal with them. If it comes to the point that we need to send the National Guard in there to try in every way to get a better handle on it, we may very well have to put more stringent guidelines as far as essential and non-essential. But we need to at least contain this there. We don't need to alert and scare everyone. Everyone knows the power that we have, and the power is just simply to be able to stay home and to stay away from crowds and to stay away from people. We've not probably done that to the level that we need to do that. We're working it as hard as we can, diligently as we possibly can, to stay on an honor-type system and everything, but there's issues. I think we had a Hobby Lobby deal, and that was a potential problem, over there, and just different things. But the net of the whole thing is just one thing: is if you're sick and you've got a problem, surely self-quarantine yourself. If you're feeling bad, if the situation gets more serious, you absolutely need to be in contact with your doctor, or naturally go to the hospital. But our health officials will brief you more about that. We expect, in all honesty, that we're not going to be immune to this terrible, terrible disease that's going across our land. But we have been making progress and keeping the curve where we want the curve to be, and we've just got to weather this terrible storm and get through it. Now, I'm going to go through pretty quickly some different guidelines. One of the things that I had to report to you was yesterday, we came in at a 2.83 percentage level. The day before, we were at 6.7. With all this stuff and this outbreak that's happened over in Eastern Panhandle, that's going to blow the 2.3 out of the water, but we are still trending in the right way, except now we've got a hotspot that we need to take care of. And, I can tell you that the DHHR has released a new data dashboard on their website. You need to be able to go to that, and I think we'll be pulling that up right here on the screen. That's for your knowledge and availability to you. The collaboration between the National Guard, DHH, and all the other agencies is taking place every day across the state. There's so many things that are happening, and this situation is so fluid, and there's decision after decision that has to be made. They're difficult decisions, but absolutely, I believe that the team of experts that I have around me is doing great work, and I will promise you there'll be no shooting from the hip from me. There'll be decisions that will be prudent decisions, and they'll be made, with the advice of many experts. I've got to, I need to announce this for sure. Our Department of Education has just told me today, now get this, we have provided at this time that is tragic and a time of difficulty beyond belief, we have now provided over 1 million, and get that now, 1 million meals to our students. And so for our Superintendent Clayton Birch that's with me today, and all those that have been out there, for the National Guard, to all those that have been helping in every way, thank you so much, because that is an incredible accomplishment, and we're still at it every day. today we lost a legend, an absolute legend, you know, and from Slab Fork, West Virginia. And many days in my life, you know, as not as your governor, but just as a private citizen, I drove through Slab Fork, and it is fitting that that this individual was born on July 4th. You know, he's 81 years old, and we lost Bill Withers today. You know, a legendary man that you know, that so many of us, you know, remember. You know, a song that referred "Lean on Me," and just a good man. And so, you know, we miss him, and we really recognize the contribution that he made to West Virginia and made to this nation and to the world. And he'll surely be missed. So let's surely keep him and all of his loved ones in our thoughts and prayers. Now, you know. Let me just read to you just some things that are just rumors out there. Rumors can poison. We all know that. You know, with the access of social media today, for crying out loud, you know, it is, you know, you could say on a nice note, it's silly. Now, on another note, you could say that it's shameful, you know, but rumors hurt. And so please, if you don't know something to be absolutely the truth, you know, and if you do and you question it, call someone and make sure, but let's stop with the rumors because they hurt people. You know, and I'm going to read these to you. Our state police are not stopping traffic at our borders. The state police are not pulling over vehicles just because they have out-of-state plates. The West Virginia National Guard is not being used to enforce a lockdown. There is no curfew. There is no national quarantine. It is extremely important that you follow the guidelines and stay at home and do all the things that I'm telling you to do, but for these rumors that are going around, please stop them, please. You know, in regard to our hotels, we've received a lot of calls from hotel operators in West Virginia asking about out-of-state travelers. I have asked the DHHR to release additional guidance today. This afternoon, we will release we'll do from a press release with this information. In regard to Wi-Fi hotspots, you know, there's a new group, or there's a group called the Prodigy Company in Preston County that's also providing free Wi-Fi, like I announced about the Countryman, you know, in Greenbrier County. And but there's I guess the best thing I can say is I have asked the West Virginia State Broadband Enhancement Council to set up a website with a map of all public Wi-Fi hotspots, and it'll be ready next week. So we'll have a map of where you can go, you know, next week. Now, the program just came out today, you know, on the Small Business Association or Administration, you know, the ability for people to go in and get loans and forgivable loans. You know, there's many West Virginia banks that are participating. We want all of our banks to participate. We thank all of our banks, you know, for all they're doing and everything. But basically, I encourage all small business owners to apply, you know, because you're basically applying this way. You know, I thought the way that it worked was, and this is the 80,000 foot high, you know, flyby, but I thought the way that it worked is you were able to apply on your payroll, and you are able to apply on your payroll. Now, you know, if you're self-employed or a contractor, you are going to have the opportunity to apply as well for benefits, forgivable benefits. They do not have those guidelines, I don't think, out quite yet. but you're able to apply on your payroll, and your payroll, what your average payroll was over the last 12 months, I believe, and then what you're able to do is come up with that average of what your payroll was, and then apply at a factor of 2.5 times that number of whatever that number was. To give you a perfect example, if that total payroll average monthly was $100,000, you multiply it by 2.5 times, that gives you $250,000. You apply for that loan, you get that loan instantaneously, and when you get that loan, then you can offset against that loan anything you pay on payroll, insurances. I'm not sure about utilities, but you offset against that loan, and everything you offset against that loan is totally forgivable. And if you don't offset things against that loan, then it becomes just a loan to you from the federal government. Now, that's how I understand it. I could be slightly off, but I'm not much off, And so I thank all the banks. I thank you for your participation, and I encourage everyone to apply, because we need to be able to be funneling money to our people and getting paychecks to them and everything, and encourage them in every way to stay home and work from home. But I guess that's all I've got right now. Again, I encourage everyone the same way I always do. West Virginians, whatever you're doing is really working, and we're trying to push the right buttons and give you everything all the information that we have. We're transparent as we can possibly be, and I'll stop at that.
Thank you, Governor. We're now going to take comments from a few of our panel members. Up first, West Virginia Superintendent of Schools, Clayton Birch.
Thank you. On behalf of the governor, I just want to say that I first and foremost appreciate all the feedback we've gotten from the field from our decisions yesterday. The governor takes a lot of advice from a lot of people, and he listens, not only from the education field but the health field. And the decisions we made, I'll reiterate, we did not take lightly. I know that we've heard of some folks that maybe weren't in agreement with that decision, but I will tell you a few things. One, overwhelmingly, our teachers are dedicated to these children. Our schools are dedicated to these children. And as a past teacher, I would have given anything to know that there was a glimmer of hope for me to see my children at the end of the school year. I would have given anything for that. And I talked of hope yesterday. And some folks forget sometimes that I, too, have children in our system. I have 4 children of my own. And one of them's a senior in high school. He'll be the class of 2020. And sometimes I don't think he watches these press conferences, and he does. And to be able to walk in your home and say, Dad, I really want to thank you that you're still thinking of us, that you're still thinking that there's going to be time and there's going to be hope that I'm going to be able to be with my friends and walk across that stage in one way, shape, fashion, form. But that's what he says. And I just want to say that all of the unions, the boards, the superintendents, they've been so supportive of making sure that we tell our children there's this glimmer of hope and that it is a single message. So I just want to thank the governor and everybody else that's helped us make sure that message is strong to our children and our families. Now, I know the governor also mentioned 1 million meals served. That is one impressive number. And, I continue to thank our service personnel, but there's a few other folks that we really need to consider. The governor helped arrange the Chelsea Ruby and the Office of Tourism and the National Guard, those that are doing the logistics on weekends to get those meals delivered. The private companies and businesses in the state of West Virginia have stepped up to help that 1 million meals being served. And I used a story on Hoppy the other day that I'll end with today. In southern West Virginia, the superintendent called me, and you could tell she had been crying. And she says, this morning, Clayton, I took a call that I didn't believe I was ever going to take. And it was an 8-year-old child who called the central office of this county, got herself out of bed, set her alarm to call the office and say, I want to make sure I didn't miss that bus. I want to make sure that my sister and I get that meal that's coming to us because that's what we'll be eating today. That's an 8-year-old child that knows how important it is that there's a caring adult there looking out for them. And so I want to continue on that message of hope, and I want to thank the governor that not only hope, But we're going to make sure West Virginians take care of West Virginians, and there's that one caring adult that's going to look out for these children. Thank you.
Thank you. Up next, we'll go to...
You know, this man's doing an incredible job in really adverse circumstances, and I've got to say that you know, he stepped in, you know, when our superintendent, you know, resigned or retired, and Steve Payne, good man, and I hope and pray that he and his wife are doing well. You know, there was some health issues and everything, and I just love them and love their family to death. But Clayton has stepped in at the helm, and what a job! I mean, what a job! What a time to step in. It was really, really difficult. But I've got to just add one more thing, and it's just this. I mean, the last thing on earth we need is controversy. You know, these decisions are really tough. You know, I'm not going to shoot from the hip and just say, oh, we just think we should close schools to the end of the year and everything, because we don't know right yet. We absolutely will know, and we will notify people in significant advance time if that's a decision that has to be made. But I was never consulted. No one ever called me, which is ridiculous. No one ever called me on the phone and said, Governor, what do you think about this and everything? You know, I mean, there is really hardcore decisions that have to be made, and we make them. You know, I closed the schools, then for 2 weeks. Then we extended that to April the 20th. Then we extended it to April the 30th. Today is April the 3rd. I mean, for crying out loud, you know, it may very well be that we have got the next move we've got to make is to cancel school for the balance of the year. But to just shoot from the hip and not listen to the experts, I mean, for crying out loud, it's the wrong thing to do. You know, I listen to my experts. I don't shoot from the hip. And today, I want to try in every way to give those kids hope. And so as we move closer, you know, a final decision will probably have to be made. And if that final decision is we don't have to go to school or we don't go back to school, well, we don't go back to school. It's just as simple as that. You know, as we get closer, we'll make that decision. And if we continue to have issues that just cropped up out of nowhere today, like it's cropping up in the Eastern Panhandle, we'll make those decisions. But we'll make those decisions with the advice of experts. And we'll make those decisions respectfully enough to pick up the phone and call our, you know, legislative leaders and everything, you know, as I wasn't called. And so, nevertheless, as we go forward, we don't need a food fight. We don't need separation. We absolutely need to keep moving forward and keep our eye on the ball and doing the right thing and making the right decisions. And that's what I'm going to do, irregardless. And so, so again, I thank Clayton in every way. You know, listen, this job's tough enough. It's tough enough for everybody that's out here on the firing line. We don't need to come up with something just to be relevant. You know, I mean, we don't need to do that. I mean, there's too much tough stuff going on out here. But just think, 1 million meals served, and you think about that little 8-year-old kid. I mean, for crying out loud, we need to continue to keep our eye right on the ball, listening to our experts from our medical community, from our education community, from our National Guard, everywhere under the sun, and doing the right thing. And that's what I'm going to do.
Okay, thank you, Governor. Up next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, hello, everybody. And as the governor said, that we are experiencing our first sort of cluster of cases of the COVID-19. And as we have talked about before, this is not surprising. We knew that nobody is going to escape this pandemic without having people that will get sick. We want to reassure people that most folks who get the virus will get better and may have the flu or flu-like symptoms. And so, you know, if you are located in the Eastern Panhandle of the state or any place in the state, then we have to presume that if you do develop a cold or the flu-like symptoms, then you very well might have an infection with COVID-19. And we've talked about the approaches to use your power to prevent getting infected or having your family or your community be infected. But the truth is, no matter how good we are, and many people are doing amazing work, and that's the reason why our percent of the tests that we've done being positive has been so stable. We also know that we're not going to avoid having people that will get infected, and we'll handle that. And the key is that if you do have a set of symptoms that are like the flu, or if you lose your sense of smell, which is the other sign of the COVID virus infection, we really want you to stay in your home. You know, if you have fever, try to separate from the rest of your family. But not only the person that may be feeling sick, but the rest of the family should all sort of stay in the house, quarantine in the house, and we will provide some opportunities to make sure that if you need something that we can get it to you. As the governor said, if you start to feel bad, in other words, if it goes not just from being a cold or the flu, that you can take Tylenol and drink some fluids and get some rest, but you start feeling chest heaviness or your chest starts hurting, then you definitely want to call your doctor. If you need to go to an emergency room, you should call ahead so that people know that you're coming in. And it's really important for us right now as a community, as a state, and not only in the Eastern Panhandle, but everywhere, that this is the opportunity for us to take the next step in our commitment to protect ourselves and protect each other. And when we've talked about the home stay, you know, it's clear that if we can do that really well and stay separated from other people generally, then this virus, which really thrives on person-to-person contact, cannot spread as rapidly. And remember, we're trying to protect each citizen and trying to help people learn how to protect themselves. But what we're really trying to do is we're trying to control the rate of spread of the virus. And since we know that this area of the state, which is a natural area for us to see an early sort of cluster or spread because of its location close to big population centers on both sides of the eastern part of the state, then we want to make sure that residents both feel safe. We have plenty of good medical care if you need it, but we want to reassure people that generally you can just take care of this and just like you would if you had the flu or another cold. But importantly, this is really the time that we want to stay separated so the virus does not spread really, really quickly. And I think that that's true of all parts of the state. And we'll work with city leaders in the areas that we have seen more activity and continue to work with Dr. Kathy Slimp and her group related to public health and the DHHR and our friends in the National Guard, but not to do any kind of quarantine or anything like that. It's really so that we can support you, and as we plan to do the whole time, that when we do have an outbreak, it becomes really important for us all to really double down on using our power to separate so the virus can't spread rapidly. We also know that anytime we see an outbreak like this, it means the virus has been kind of passing through that part of the community for a little bit. So probably a week or maybe 10 days, the virus has been passing back and forth. So it's really important that we take every opportunity to separate and stop the transmission of the virus in this part of the state particularly. And ultimately, we will support and we're ready to support any care needs that people in the Eastern Panhandle or the rest of the state have. And we want to make sure that this is not seen by people as a moment to panic, because it's not. And this is part of what every state will go through in this pandemic. So if we stay together and stay confident and use our power and support each other by staying apart and not letting the virus spread quickly, then we will be able to navigate this just fine. And as we have talked about before, we're still doing great. As a state, we are among, if not the best state in the country, and this doesn't change that at all. This is just part of what we have to navigate as we get through this part of the viral pandemic. So stay together, stay strong, and maintain your power, and double down right now, because this is an important time for us to block the spread. Thank you.
Thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As of today, we have 440 National Guard personnel on duty. We believe that we will surge to 500 by Monday of next week. We have conducted 21 training missions for retail outlets for the decontamination and personal protective measures. We have 20 additional trainings going on today for those retailers, and training going on for PPE equipment for first responders and hospital workers today as well. Next week, we have as many as 50 events scheduled for training. Again, all these are designed to help us reduce the spread of the virus by doing the appropriate things that folks like Dr. Marsh, Dr. Schlemp, and the governor are requesting that we do. Related to stabilization of the population, with the 2 food banks in Gassaway and Huntington, we packed over 1,600 family meal packs in the last 24 hours. During the next 24 hours and over through Monday, we will be working with Marshall Telemedicine and WVU Telemedicine to do communications checks in underserved broadband areas using specialized National Guard equipment to be prepared to support more telemedicine in outlying areas during this event. In addition, we delivered, as I said yesterday, to all 55 counties yesterday supplies. This included 4 ventilators that we received and calibrated, and those ventilators went out to Cabell Huntington Hospital as well as to CAMC. In addition, our team supporting the Public Health Office at DHHR conducted 236 contact engagements yesterday related to the contact tracing work, and we continue to work that aggressively. We have 2 senior personnel from the National Guard working with Workforce West Virginia and our Secretary of Commerce to develop a plan to surge National Guard personnel distributed throughout our armories to help address the unemployment claim backlog that currently exists. VOAD is working today aggressively and over the weekend to address concerns related to our homeless population as well as our shelters. I'd also like to point out that as the governor has directed, and he talked about earlier, as we have done in both Monongalia County and Kanawha County, we will surge National Guard assets to help our public health partners, Dr. Marsh and his team, to address the surge in numbers in those areas. Those will include things such as additional personal protective equipment support using the reusable systems that we were able to purchase. It also includes providing additional equipment support. We will also provide a surge of staff into the local public health office in the counties affected, to include additional epidemiology support to our state public health partners for additional contract tracing and the things that may need to go on. And then where necessary, support the movement of rapid field testing for essential workers such as healthcare workers, first responders, and law enforcement to avoid any clusters concerns in those areas. Again, as the governor pointed out, this is a surge capacity that the National Guard will provide to our local communities to address the problems that we face. The last thing I would leave you with, going out across the internet, some folks have received a flyer on their car, others in the mail, that has a National Guard watermark on the back of it. And it talks about the FEMA invoking the Stafford Act and mobilizing the National Guard nationwide. I want to let folks know that that information is both false and inappropriate. If you have questions or concerns about what the National Guard is doing in the various states under the direction of their governors, I would suggest that you go out and, in the case of West Virginia, go out and look at our website and our social media presence. We try to be upfront with all the citizens on all the work that we're doing across the state of West Virginia to address this situation. It does not have anything to do with anything related to law enforcement activities. Our state police, our county sheriffs, our local city police departments are handling that because the citizens of West Virginia do the right thing in critical times. They're listening to the governor. They're listening to what we're saying, and we do not need to provide that level of effort. So again, I ask you to quit paying attention to these unfortunate documents that are being put out across the state. The National Guard is surging capacity across agencies to help with the most important things we need to do to address this issue. Thank you.
Thank you, General. We'll next go to the West Virginia DHHR with Secretary Bill Crouch and our State Health Officer, Dr. Kathy Slim.
Good afternoon. I'll be brief. What is important right now is that we stay the course, as the governor has said. We will have more cases and we will have more clusters. I have actually had individuals approach me with the understanding that we're going to get through this unscathed. We are not. We're continuously working on plans for a surge. We will have a surge. Our plan is to make sure that hospitals, and they're working very hard with their own surge plans. We're looking at what happens if our hospitals reach capacity. How do we take care of an overage of patients that might come in for care? And we're working hard on that. We're working also with our long-term care partners in terms of a plan for the long-term care industry. And for our psychiatric hospitals, our homeless population, and others. So we're looking at this very comprehensively. The governor has asked that we make sure everyone is protected through this process. So again, there will be more cases, there will be more hospitalizations, and we're going to be prepared for that. So please know we're working to make sure that we have all issues addressed here. Be safe, and again, thank you to our healthcare workers out there who are on the front line.
I think Dr. Marsh has gone over many of the public health prevention measures that we wanted to make sure we get out, and we certainly will be working with Eastern Panhandle more closely on several of those. Again, though, it is that reiterating to please operate with that physical distance and to practice that physical distancing and to follow the stay-at-home orders to the extent that everybody can do that is really important. And then the other thing, again, that he mentioned is that stay home if you are sick. And we really ask that our essential service employers also work with their staff in that, because it's not in your interest to have anybody sick in your facility at the time. Those essential businesses are critical, but we also need to make sure that they operate in ways that can minimize spread while folks are maintaining those services. So we please do ask that those essential service employers really think of that. We know they are thinking about that. Many are doing it in very, very effective ways. It's really worth all of them doubling down on that and really working with your health department and other leaders to really understand how you can do that most effectively to maintain your service and maintain your business, but also to protect your employees and to reduce spread so that you can sustain that business more fully. A couple of other areas, we are excited to have the new dashboard launched. We encourage folks to go look at that at the coronavirus.wv.gov website. From here on out, we will be having that data updated every day at 10 a.m. And so you can find that there each day as well. As you look through it, there are some click on here for more information links, and those are important to look at. That will give you actually a county level map, and you can click on the county and get the actual numbers for your county. It also displays information around some of the overarching, the number of cases, what's their gender distribution, what is their age distributions, those kinds of little deeper questions that folks have been asking. So that is there. Then there's also a page for more information on the testing distribution and then also the percent positive. So hope you enjoy and find meaningful and useful flipping through the newer dashboard there. As we have additional information that we think is going to be helpful to tracking things, we'll begin to add that as well. The only other thing I wanted to cover was we do have a few new guidances that have been evolving. Those include, there's a fact that are now posted on the website. Just want to highlight those for people. There's a fact sheet for individuals experiencing homelessness that's up and posted now, and some additional tools that that other folks have been working on around that arena that are also going to be available soon if they're not already posted. There is guidance on food takeout and deliveries, which included some guidance around handling cash back and forth with those kinds of settings. And then there's going to be updated hotel and motel guidance that is coming out shortly as well. There's been some out there, but we'll update that as well. So I'm going to, I think, stop there and move over to back to Jordan for questions.
Thank you both. Next, we're going to take a few questions from media members who are joining us virtually again. The first questioner today will be Mark Curtis with WOWK.
Yes, Mark Curtis, 13 News. Governor and the other folks, if you could give us some more specific information about what's going on in the Eastern Panhandle in terms of the numbers we're seeing, the rate of increase, and is there a common denominator there, like this was related to a nursing home, or the fact that a lot of people in the Eastern Panhandle were employed at Dulles Airport? I mean, give us some more background and some more numbers on this.
Let me begin it. From what I've been told, and again, Mark, you expect, in close proximity to D.C., you expect that could very well be an area where we could get an outbreak or a hotspot. Berkeley and Jefferson County, I think we've had 60 positive tests that have now come back over a period of time, because some of those tests were, took 7 days to get the test back. But I'll defer now to Dr. Marsh, and Dr. Marsh, you can give us some more detail. But the people there, we don't want the people there to be afraid. We just want them to double down on being really smart in what they do, and we may very well have to make some additional moves as far as essential and non-essential. But Dr. Marsh, if you could jump in.
Thank you, Governor. And I'll make a couple of comments, and then I'll also pass to Dr. Slemp. This is just information that we are becoming aware of almost at the time that we were coming on this press briefing. So we have work to do to understand more of the details. We do believe that this is a community transmission, which means that, people in the community have likely been part of moving this between each other. So that's the reason why it's so important for us to really ask people to focus on separating. Again, the lifeblood of the virus is person-to-person contact. So the more that we can separate people, we cut off that source of rapid spread and that tempo of the virus. Because as was said by Secretary Crouch, we know that we will have cases and clusters and areas of the state that will be affected by the virus differently. And this is a likely area, as we've said before. But the issue is we want to make sure that we control that rate of spread so that our health system works well. So if people get sick, we're able to take care of them. And we have every confidence that this will not overwhelm our healthcare system. And we've already made a lot of plans to support the potential that we're going to have people that will be sick and will need care in a hospital and maybe even an intensive care unit. So we want to start to have people double down on using their power personally. And also we want to make sure that we are not bottlenecking everybody trying to run to the hospital, because that doesn't help our healthcare workers nor provide those essential needs of people that get sick in the community. So as the governor said, we will look at how we can continue to help people reduce the spread of the virus. People need themselves to work to reduce the spread of the virus. We will do the appropriate work to understand more details about this and become more specific about what we do. But right now, this is the first part of us being in a position that much of the rest of the country has experienced. And again, this is part of dealing with this pandemic. So Dr. Slum?
Thanks. I think Dr. Marsh has covered much of that. It is a situation of this, we don't think it is one particular outbreak in terms of one facility or one entity. It is more community transmission is what as we're starting to learn more and hear about things. But again, we are continuing to learn as this evolves. There are some strategies that you put in place in these kind of situations when it begins to be more community-wide spread. And that again is, some of it is bolstering down on the things that we've been talking about all along. So that really is that physical separation, and folks really taking that very seriously. It does include looking and carefully looking at the essential services that are being done and the businesses that are still open, and making sure that everywhere we can, we have people staying home that's effectively can be done, and that the businesses that do need to stay open really are practicing as in ways that are most effective of preventing spread and sustaining that business operations as well. We also, that shift to, it's not even a shift, we've been talking about if you're sick, stay home anyway, but recognizing and just being very clear that you don't have to have a positive test to manage this. You really can actually treat presumptively, and the majority of folks will have mild illness, can do that at home. They don't need to get a test. They don't need to get to the healthcare system. They simply need to manage it, assuming that they have it, and then that will prevent spread to others as well. So there's some ways that we can work with that. And so there's a variety of things that we can collectively do in these situations that really can help folks use the power they've got and manage the situation effectively as well with that. So we'll be happy to support them in any ways that we can with that as we move forward.
Okay, thank you. Up next, we'll go to Brad McElhenney with West Virginia Metro News. Brad, you there?
Oh, sorry for my delay. Technical difficulties. Trying to push the right button. Can you update us on what's happening in West Virginia's corrections system? Has anyone within a facility in West Virginia's corrections system been diagnosed with a positive case so far?
Bill, I think you've got to answer that, But to my knowledge, it has not been reported to me that anyone. So as far as I know, to answer that question, Brad, right now I don't know of one that has come to my attention. If Bill, you could follow up, but I don't think any.
Are positive? No, I have no knowledge of that either, Governor. I've not heard that.
We haven't heard of any positive.
So for right now, for the knowledge that we have, zero.
And again, these are the areas that any kind of institutional setting, the real focus is on how do you minimize the risk of it either entering or it's beginning to spread if it does enter. And so that speaks in all of our systems like corrections and healthcare settings, et cetera. That's the importance of that screening and those reduced visitations and all that work that we need to be doing to, again, both prevent introduction into that congregate setting, and then the things that we do internally to prevent the spread if it does occur, or to minimize the spread when and if it does occur. Recognizing the virus really is around us.
Okay, thank you, Brad. Next, we'll go to Stephen Allen Adams with Ogden.
Yes, Stephen Adams of Ogden Newspapers here. Question, where do we stand as of today in regards to unemployment compensation applications? Also, do we know anything about where our current unemployment rate stands as of today?
Okay, I'm going to ask Brian Abraham to give you some information in regard to that, but Stephen, I said yesterday that we had 90,000 claims in the month of March, and last year in the month of March we had, I think, 3,400. We're overwhelmed. The system is overwhelmed, and we're trying to process that, and we're bringing in additional people like crazy and trying to process that and get those claims out. But as far as Brian, maybe you could add to that.
We don't have today's numbers yet, Steve, but we expect those in the afternoon as they finish processing the day's claims and they batch those at night. I can tell you that we have deployed several Guard members over there to assist, as well as we've tried to help them update their systems The CARES Act is just now rolling out. The rules are still being looked at, so there's a lot of unanswered questions that they're working on every day, and we'll just continue to update you as we get the information in here.
I just add one thing, and that is, Stephen, we'll solve the riddle. It has overwhelmed the system, and it's overwhelmed the amount of manpower, but no matter what it takes to be able to, and one of the things, that is for those that we're being slow on getting to, everyone should understand that all your benefits will be paid, and we just got to do better about amping up, even though that we're overwhelmed with the number of claims.
Okay, thank you. Up next, we'll go to Kenny Bass with WCHS.
I have a question for Secretary.
Can you try that one more time?
I have a question. Yes, I have a question for Secretary Crouch if he's still with us. And the question is, can you go over the policy for DHHR's state hospitals? We've heard from several people, and they've said that they're being told by supervisors that if they are not feeling well, they should still come to work. They're still needed. And if they have a small fever, they still have to come to work. That would seem to fly in the face of what you guys are saying in these briefings. So have you clearly communicated your directives to all of your supervisors and all of your facilities?
Yes, we have. That is incorrect. We have communicated with our commissioners and all of our employees. We certainly don't want any employee coming to work with a fever or sick. That's probably one of the rumors that, as the governor spoke of earlier, that is not the case.
Okay, thanks, Kenny. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Good afternoon. Can you all hear me?
Yes, we can.
Good afternoon. Can you hear me?
Yes, we can hear you.
Can we get more geographic specificity on where the hotspots in the Eastern Panhandle have occurred? It seems you mentioned 2 counties, but are these specific to particular localities or municipalities?
Bill and Kathy, I think you ought to say that. From what I've been fed so far, I was told that some information about the Hobby Lobby, but if y'all can elaborate, please.
The preliminary information I've got is it's not specific to an individual community. So that's why we're looking at this more in terms of a larger geographic location. It's not a particular facility. It's not a particular town or jurisdiction. It's really a broader community-based spread. So we're looking at that early, but we're actually looking at it more geographically.
And if I could just add one thing, this is Clay. I think it's also important to note that we have gotten information. Can you guys hear me okay? That we've gotten information. This has happened over a period of time. So we're getting results back from the private labs, which is about a week or maybe a little bit longer old when the samples were drawn. And we have information from our university lab that was done the last 24 hours. So we see that this has been going on now that we can see it, view it. So we know that this has been exchanged in this community for a period of time. And so we know that what our citizens have done have given us a lot more time. It's helped push our sort of time frame to today from maybe a week ago or so, which is fantastic. We've gotten a lot of chance to prepare, but we also know that by doing the right things today in the eastern part of the state, we will then see the benefit from that come out over the next week or 10 days or so.
Okay, thanks.
Do we have any more specificity, in regard to the fact that, I think it'd be really helpful, those people in those counties, if we could say, that, we had more cases, or we had a lot of cases, in Martinsburg or whatever it may be, but if we got cases, positive cases all across the county, is that what we're saying?
I think we have to recognize that, we have data from the testing, but we also recognize and we understand that those testings don't necessarily capture every case. And so I think what we're looking at is we say and understand that we have enough to know that it is transmitting within the community across a broader geographic area. So we don't necessarily just rely on the testing data alone to suggest that. And so it's really more important to be thinking and understanding, since that we've got borders that are not that are kind of artificial in these areas, that we are looking at an area or a region that is beginning to see broader spread.
And Governor, this is Clay. Just one other comment, because Dr. Slimp is the expert and she's absolutely right. But this is really hot off the press. We just had a conversation at 11:30 versus the 12 p.m. briefing. So as we find out more information about the more specificity, as many people are interested in, we will be happy to share that with people. So this is not an issue about we're not happy to share. It's really just an issue that we just found out about it. So through the afternoon, we'll have a lot more information and a lot more specificity that we'll be happy to share with, with the state and certainly with you, Governor, as we learn more.
Okay. Well, all I would say to that is, everyone's sitting on the edge of their seat nonstop, including me. But as soon as we get the information, and we've put it together in some kind of format and everything, I know you'll get it out as quickly as you can.
Up next, we'll go to David Beard with the Dominion Post.
Hi, David Beard, Dominion Post. This is a follow-up on the comments that the unemployment system is overwhelmed. Readers are contacting us and saying they're getting booted off the website or not getting their phone answered when they're attempting to apply for unemployment, and they'd like to know what they should do.
Brian, please.
They should continue to try to reach out to workforce.
Let me just say this, everyone's got to completely understand that we're dealing with something that is overwhelming. It's a pandemic. It is something none of us have dealt with. But I want everyone to know just my feelings, and my feelings point blank are just this. If you're sitting at home and you've made a claim on unemployment and you are scared to death about what's going on, that's not acceptable to me. It's just not. And I don't care, that we've got to put, 150 more people on it to be able to get it done. Just continuing to have people call and not answer and all that stuff is not good enough. And so, all I'll do is just go back to the well and I commend everybody for all their hard work. I thank them from the bottom of my heart, but I'm going to tell you, we can't quit running until this is over. And that's just not gobbledygook coming from somebody that's blowing smoke. I mean what I say, in the fact that I'll go back and we'll just pound the sand even that much harder to see if there's some way, somehow, we can break this backlog, because people sitting at home worried about how they're going to pay the power bill and whatever, it's just not, that's not good. That's just plain not good.
Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron from WSAZ. I wanted to delve a little deeper into changing maybe essential and non-essential workers, and then also restrictions maybe at stores and things like that. Have you thought about implementing a statewide mandate as far as how many people are allowed in stores at specific times? And do you have a time frame on potentially limiting and kind of going deeper on who is an essential worker and who is not?
Amanda, I hope everyone knows that everything stays on the table. this is very, very fluid. And just like Dr. Marsh and Dr. Schlemp and Secretary Krause said, we just got news at probably 11:30 to the situation that was happening in the Eastern Panhandle. We'll be looking at everything you said from the standpoint of limiting the number of people that are in the stores at a certain time, doing anything and everything we can to slow this thing down, and especially slow this hotspot in the Eastern Panhandle. But Dr. Marsh, or someone else, if you'd like to comment, go ahead.
I'll take a shot at it, Amanda. This is Clay Marsh. So I do think that as we look at getting more cases here in West Virginia, which we anticipated absolutely happening, then in our tool belt is really starting to think about tightening down some on the businesses that really do, serve an essential public need immediately versus businesses that may be important, but may not be as urgent in serving that need. So certainly with the governor and with the governor's cabinet and leadership group, and certainly DHHR and others, we will start to look at that so that we can continue to reduce the potential for the spread of this virus. And I think as we start to move forward, it's clear, and we said this before too, and I think it's important and bears repeating, that all of the data that we know of that works the best relates to the public's agreement, cooperation, and commitment to separating, to staying at home, doing it under a more forced move or quarantine move, although you saw that in China and maybe in some other countries that are much different than ours, that we know it works so much better when people do this by agreement. So we're really, in many ways, not only looking at the essential, non-essential businesses, we're really pleading with our citizens to continue to do what you're doing, but do it even more with more focus. And I think that we have come together as a state. We've done amazingly well. Great job, West Virginia. But now we are in the same game as every other state is, and we're not immune from having people get sick with this virus. And now it's time for us to really focus on reducing the rate of spread.
Thanks. We have time for one more question. We'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor, and this is for also the health officials. I'm curious, is there any sort of inventory for medical resources that are out there, ventilators, ICU beds, other things that hospitals will need in a surge? And secondly, I'm curious, sort of on the side of that, if you could respond to the information that was put out by FEMA and the House Oversight Committee about requests from the state of West Virginia and what we've received to date.
Okay, I think the last part, General, you could probably add some light to that, but and then I'll turn it over to the healthcare community, medical community.
Yes, sir, Governor. So we track with the Department of Health and Human Resources, particularly with the Public Health Office, daily, the number of beds available, the number of ventilators available. We manage those against our current rate and what the projected rate of a surge would be. All those things are tracked on behalf of, with a team effort from Public Health, their Threat Preparedness Office, the National Guard. We're using some additional resources from WVU and Marshall to help us track those things. We also balance that against the personal protective equipment available. As you will remember, early on in this effort, Governor Justice authorized us to go out and buy personal protective equipment that is reusable and can be decontaminated. That's one additional tool that we put in our tool belt to be able to manage potential surge activities, and some of that PPE is already spread out and others gets moved around the state as necessary. So all those things we are working daily to manage and work with on behalf of our public health partners.
And I could speak a minute. This is Bill Crouch. I can speak a little bit about the surge itself that we're looking at. One of the first things we do every morning is look at those projections the general referred to and try to make sure that we are on top of how many beds might be needed at any one time. Those projections, as I think Dr. Marsh has talked about, are good from the standpoint of the governor's push to be proactive. We're one of the few states that took action before we had a positive case. So our curve is staying low. We're running about 4%, but we have hospitals with empty beds. We try to stay on top of that every day. We have actually several hundred beds now in the state of West Virginia that are available. Should that surge start, we're ready for that surge. Hospitals have their own surge plans, and then we have plans for surge capacity that might exceed the hospital's needs. So we're looking at that for the acute care hospitals, for nursing homes, and all other sectors of healthcare. So we are very much on top of that.
And this is Clay Marsh. I just wanted to add just a couple of things, and this is really related to what General Hoyer and also Secretary Crouch said, that as of today, we are projecting a buffer of 771 acute care beds that could be used as part of what we need. And we have a buffer of 69 ventilators from what we believe would be our sort of maximal current sort of surge capability. So ultimately, we are well positioned to take care of the folks in our state who would, who might get sick from this, and some who will get sick. And I think that the key, again, is just as West Virginia has been doing by being responsible individually and together, we are reducing the rate of spread of this successfully. So we are not overwhelming the capability and the capacity we have. We're planning for all contingencies. So if it turns out that we get a lot more, then we can handle that too. But the goal would be to continue to do what we're doing so that we reduce the rate of spread of the COVID-19 virus. So then we are well able to handle whoever needs help in our acute care hospitals throughout the state, not just in the Eastern Panhandle, but anywhere. And I think that that's really to the credit of the folks in West Virginia so far, that we've been able to open up this time and so far been able to control that spread. So I think it's time for us to double down, and we are in good shape at this point to be able to take care of anything that occurs.
Thank you, Governor. Back to you.
Everyone, I would ask you to keep Bill Withers and all of his loved ones in your prayers. I would ask you everyone knows from watching our president and watching what's going on across the country and everything that in West Virginia we've been blessed because we've been proactive and we've gotten ahead of this, but we're not going to be immune to what's going to happen here and what could happen. And so we just need to stay the course and stay on top of what we're doing. And please, I ask for all your prayers for all the healthcare workers. Their bravery and first responders, their bravery is just unmatched. But absolutely, we have got to keep them in our prayers, and we've got to continue to work every day as diligently as we can to provide them the protective equipment that they need to be able to take care of our citizens. So I ask you that, and I ask you to just stay the course and keep moving in the right way, as great West Virginians will do. Reach out and help in any way you possibly can, but please take heed to everything we're saying. Thank you so much.